I started my treatment for metastatic brain mets with one oncologist. She was fantastic in that she got me on a clinical trial that really made a difference in my care. Right after my trial started, I needed some reassurance that I was moving in the right direction with it. And so I do have a background in being in healthcare and recognize that all doctors have different areas that they like to focus on and specialties. So I did some research and I found out who was doing the most in the brain met space, both in taking care of patients and research. Her name um, kept reoccurring under current trials and past trials. And after feeling confident, I called up and got an appointment with her. And they were wonderful in fitting me in. I just needed somebody to confirm, anybody who's been diagnosed with brain mets or metastatic disease in general, it's terribly frightening. You're dealing with your life, and I think we all want to make sure that we're getting the best care we possibly can. And so I just needed that confirmation that that clinical trial was the right direction. I knew that I could stop the clinical trial at any point if I wanted to. So, about a month after I started the clinical trial, I had a second opinion and really liked the physician. Her name is Dr. Nancy Lynn, and really liked her a lot. And she confirmed that if she had been my treating oncologist, that that's what she would have picked out for me as well. And that was really reassuring to hear her agree with the oncologist that I was seeing locally at the time. It gave me just the confidence I needed to continue on with that clinical trial. I was still within 6 weeks of being diagnosed with metastatic disease. So everything is still very raw and new to me. So it was just really good to get that confirmation. The plan at that time is that she would consult with my local oncologist, and that they would touch base when needed. The That absolutely took place. And while we did that for a while, the one thing that I didn't like about that situation is that I wasn't included in those discussions. And it wasn't because they purposefully excluded me, it just was the way that it worked. The two doctors would chat and have a conversation about what was going on, and then the message was relayed to me, and I was left with questions. My oncologist didn't specialize in brain mets. There aren't, that's not something that's a negative. You don't have to have a doctor that specializes in brain metastasis, but knowing that Dr. Lynn was out there, and, I had additional questions that I wanted answered and didn't really have access to her. I went back to her a second time. And at that point, I decided just to switch my care to her. I could have kept it that she continued to consult with my local oncologist and that they worked as a team. But for me, I needed more than that. So I did switch my care to her. And although I lived in one area that I lived in Chicago, I actually at the time I lived in St. Louis. I've kind of moved around a little bit, but um, I flew to see her for my scans and treatment in Boston, and it is a lot of work. I still do it to this day. I've been doing it for nearly 5 years, and that's just what has worked for me. But it doesn't mean you have to do that if it's something just people use second opinions, like I said, to confirm that what they're doing is what that oncologist would do because they have an expertise in it. I think it's a good sign when your oncologist is willing to work with somebody else. The medical field in general is complex no matter what disease you're dealing with, and nobody has all the answers for everything. So the more input you get, in my opinion, the better. So having, a team approach where you're having two oncologists bounce ideas off of each other, I think is a best case scenario, especially with brain mets. It's a really complicated area of the disease to treat, and to have somebody who that's their main focus working with your oncologist, or if you choose that person being your oncologist. When you work with somebody who specializes in brain mets like I do, they work in a team setting. So I'm seen by a medical oncologist, a radiation oncologist, a neuro-oncologist, was later added when I needed that. And she knew that, Dr. Lynn knew to add that because of her experience with brain mets and that being her area of expertise. So that has worked out in my needs the best way it possibly can.